Welcome to Pearls of Wisdom. Today, we're here to discuss a topic that is really important to our industry, and that has really become especially important over the last 2 years, and that's mental health. It's somewhat commonly known that dentistry is a very high-stress profession for a number of reasons. So it only makes sense that when you add a pandemic on top of that, and has now lasted going on 2 years, it would create a tremendous amount of stress and challenge for dentists and their dental teams. I know we've seen and heard about it from our own staff and colleagues here at Delta Dental of Massachusetts, and on a personal level, we all feel it in our own lives. That's why I'm especially excited to have with us today Dr. Kyle Stanley, who is a practicing dentist based in California and a passionate advocate for mental health and dentistry. Kyle, thank you so much for joining us today.
Thank you. It's an honor to be here.
Dr. Stanley, thank you so much for joining us. Before we get started, just tell us a little bit about yourself and why you became so passionate about mental health.
Yeah, so I'm a dentist in Southern California. I come from a family of dentists. My dad's a dentist, my brother's a dentist. And I loved my profession. I still do love my profession, but unfortunately, I went through a difficult time. I went through a time that, by all standards of today's society, I had it all. I was, making great money. I was a doctor. I was well respected. I was driving sports cars. I had a celebrity practice in Beverly Hills, and I wanted to quit. And luckily, I had people I could trust and I can open up to, which was, my father and my brother. But many people don't have those people that they can trust and open up to and be vulnerable with. And I was able to come through this. And so I wanted to start something that could help some of my other colleagues that were going through hard times. And so I ended up creating a CE course called Lightside and a support group as well for dentists.
Well, Dr. Stanley, that's a very powerful introduction to our topic today, and thank you for sharing your story. What is it about dentistry, or our profession, that causes so many issues for people?
Dentistry is a hard job. We are living in an environment of fear every day. I think that's something that, as dentists, we understand. We are giving injections, we're doing things that are expensive, we're doing things that are potentially uncomfortable or even painful. And what we never sit and think about is, how does it affect the dentist, right? Because we're always saying, we want our patients to be okay, and that's what we should do. But we never think about how that is affecting us physically and mentally. There's some studies that show that when a dentist gives an injection, their blood pressure can raise 20 points. Now imagine you give 20 injections a day. Think of the high risk of blood pressure that you have, right? And our cortisol and our adrenals are constantly firing because we're in this fight or flight mode, trying to take away the pain from our patients. I mean, that's just one aspect of it. There's so many different factors that are very specific to dentistry and are probably would take up too much time for this segment.
Wow. Dr. Stanley, when what you just described was certainly present prior to COVID. How did COVID exacerbate all of those things that you just described?
As dentists, that is oftentimes our identity. We went to school for 8, 10, 12 years. Sometimes we do this every single day. Our friends introduce us as, oh, this is Kyle, he's a dentist. We're like dentist, dentist, dentist. And then you bring us home for 6 weeks and we're not doing anything. And we feel like we've lost our identity. And that, I think, was one of the biggest ones, was I'm only worth doing dentistry, which is a big problem in dentistry. And this was a problem that I had. I aligned my purpose in life with my profession, which I think is something we should never do, especially in a profession like dentistry, where you're bound to have complications. You're bound to have revisions, right? A crown may come off, a patient may be sensitive, an implant may fail. I mean, these are just things that happen. You have an imperfect being, the dentist, working on another imperfect being and expecting it to be perfect. Once we can separate our purpose from our profession, that's when dentists can really enjoy their profession and realize that it's your profession. It's not who you are. So that was probably one of the biggest ones. I mean, an obvious answer would be the financial portion of it. Many dentists, although many of us make okay money, what we actually keep isn't that much. When you think of, most of my students in California coming out of school are in debt over $500,000. And that's before they buy a practice, before they buy a house, before they get married, before they, invest or whatever it may be. So there is a lot of financial burden, even for, us doctors, right? All of our friends think that we're all so rich, but they don't see a lot of the financial stress that comes with it.
So you've got a situation where you have inherent stress. What's the biggest change you've made to try to turn this situation around? Or is there one thing that you can point to and say, this helped us reduce burnout?
Yeah, the biggest one for me personally, and the hundreds of doctors that I've mentored through this light side community, is that separation of purpose and profession. A lot of us dentists, we're obsessed with dentistry. If we didn't come in being obsessed with it, it's kind of ground into us. I mean, we measure in tenths of a millimeter. And, when we go home, we read dental journals, we look at dental videos, our Instagram feeds are constantly dentistry. And I had to think of what I wanted to be known for when I wasn't here anymore. And before I went through my hard time, it sounds silly to even say it, but I wanted people to say, Kyle, the best dentist in the world, or not, on my tombstone, I probably wanted it to say Dr. Stanley, right? Dr. Stanley, the best dentist in the world. And now I think of how silly that sounds. I want to be known for being, a great father, a great husband, a good neighbor. Now, if they happen to say, oh, he was a good dentist too, that's fine. But I don't want my identity to be my profession. So once I realized what my true purpose in life was, which for me was to be a father, that was when I could put my profession in its place. Now, I can still be passionate about dentistry. I can still strive to do the best. I can still give my patients, the best of me. But I have to make sure that I still have something left when I come home, because that's where my purpose is, right? My profession is what I do to make money. It's not who I am.
Dr. Stanley, you've described so many people that we know, and when we do that, because we all love our dentists, when we do surveys, it consistently comes back that people love and trust their dentist completely, adding up probably more stress and an idealistic standard that you hold yourself to. Dr. Stanley, thank you so much for that. Before I let you go, this has been one of the most impactful Pearls of Wisdom episodes that we've done in 24 months. So thank you again for that. Can you give us some tools that can help dentists to get through this very difficult topic?
Yeah, so in our group, we talk about DERMS: diet, exercise, relationships, meditation, and sleep. And it's kind of a cyclic thing with dentistry, right? You're working in a stressful profession. So you come home and you're up all night thinking about something that went wrong with a patient. And then you're not eating, you don't have time to exercise. That then causes bad things to happen with your relationships. And so we go through step by step what to do. And even little things like exercising, is so research proven to help with anxiety and depression and stress. And the research shows you don't have to be a gym rat, right? You work out 3 times a week for 45 minutes. I mean, we're all on our phones more than that. Little things like focusing on our relationships. There's a very good study from Harvard, one of the longest human studies ever done. And it talks about how the people that are the happiest, that live the longest, are not necessarily the people that, eat the best or exercise the most or sleep the best. It's the people that have the best relationships. The people that put their relationships ahead of anything. And this goes back to your purpose, right? When most of us are on our deathbed, we're not going to be saying, God, I wish I prepped more teeth. I wish I took better impressions, right? We're going to be saying, Thank God I went to my son's hockey game. Thank God that I was there for them. That's what's important, is our relationships. So I would say, take care of yourself, make sure you get good sleep, make sure you're eating right. That all relates back to your stress. Everything that I talk about relates back to the stress. And focus on your relationships, because that is the most important thing that we have.
Dr. Stanley, thank you so much for this conversation. I know that there are dentists out there that are listening to you today, and they're shaking their head, and they're probably saying, that's me. He's describing me. So I can't tell you how impactful your words are, and to see someone that's gone through that come out the other end in such a healthy way. Thank you so much for what you're doing.
Thanks. It's been the most rewarding thing that I've ever done in dentistry, talking about this subject. I feel like I can really connect on a human-to-human level with my colleagues. So thanks for the opportunity to share my thoughts.
You're doing a great job, and I guarantee you're having an impact. Thank you again. And for our providers or anyone who is struggling right now, first, we want you to know we hear you and we support you. We are fortunate here in Massachusetts to have some of the best dentists in the country, and your commitment to providing excellent care for your patients throughout all the ups and downs of the last 2 years has been incredible. For anyone who wants to learn more and dig deeper into these issues, we will have more info on our website. Thank you again for joining us, and we look forward to talking more about this important topic. Our door is always open. Thank you.